If the pain runs from your lower back into the buttock and travels down the leg, you've surely heard the word sciatica. Or you've thought about a herniated disc, a pinched nerve. And almost always, in this situation, everyone looks at the spine. But here's what's important to know once you're past 60. Very often, this leg pain does not come from your back at all. It comes from a small muscle deep in the buttock. And today, you'll see that for yourself. So this video has two parts. First, a short test. In 2 minutes, you'll know whether this is your case or not. Then I'll show you 6 simple movements you can do at home, sitting in a chair and lying on the bed. And let me say right away, this is not folk medicine. The fact that a tight muscle refers pain down the leg is described in medical atlases, and for decades, it's been mistaken for inflammation of the sciatic nerve. So let's not guess. In just a couple of minutes, you'll work out for yourself what kind of pain you have, from a muscle or from a pinched nerve. That's exactly where we'll start. Before we do anything, let's figure out what your pain even looks like. This isn't a diagnosis, it's a simple self-check, so you don't waste your time. Be honest with yourself, and by the end of the test, the picture will clear up. Let's start with the most important thing, the red flags. If you have even one of these, the test stops right here, we set the exercises aside, and you need to see a doctor. First, numbness in the groin or between the legs, as if you'd sat on ice. Second, if you've stopped feeling the urge to use the bathroom or stopped being able to control it. Third, the leg is visibly weakening, the foot drops, your toe catches on the floor. Fourth, the pain came on after a fall or a blow. Fifth, pain with a fever, or night pain that wakes you and won't let you sleep. Got it? If none of that is there, let's move on. And now, the most important part of the test, what the pain itself feels like. This is a signal everyone has, even without touching it. Pain from a muscle is usually deep, dull, aching. It can feel as if something inside is clenched. It is spread out and hard to point to with one finger. It often gets worse when you sit or stand in one position for a long time, and it usually lets go when you change position or move around. Pain from a pinched nerve is completely different. Sharp, shooting, like an electric shock, running in a narrow strip down the leg, often reaching the calf and the foot, and frequently with numbness or pins and needles. The medical atlas says exactly this. Pain from a compressed nerve is sharper than from a muscle, and it reaches the shin and the sole of the foot. Remember your own sensation, dull and spread out, or sharp and shooting. A quick nerve check, the cough test. Cough calmly or bear down a little. If something shoots down the leg to the foot, that points toward the nerve and the disc. If nothing changes, that's against a nerve cause and a good sign for us. And now, let's try to find this muscle with your hands. If you can, that's already direct evidence. First, the landmarks. The greater trochanter is the hard bump on the side of the hip, just below the waistline. Place your palm there and shift your weight from foot to foot, and it moves under your hand. And the sacrum is the flat bone in the center, at the base of the spine. Picture a diagonal line between them. Deep along that line lies the piriformis muscle. Press with your thumb or your knuckles, slowly, deeply, and look for a tight cord or a knot. And here's the important part. Don't miss it. If you didn't find anything special with a finger, don't rush to decide everything's fine. It's very hard to work deep into a muscle on yourself. Simple example. Press on your own shoulder muscle, the trapezius. It feels bearable. But when a massage therapist works it, you jump. With the buttock, it's exactly the same. It's large, it sits under a layer of tissue, and with your fingers, you often simply can't reach the point. So a weak response to a finger is not yet a no. There's a more reliable way. If you have a tennis ball at home, or any firm, springy little ball, even a hard dog ball, do this. Stand with your back to the wall, place the ball between the wall and your buttock or the side of your lower back, and gently lean your weight onto it. Now move your torso just a tiny bit. Roll the ball over the spot in a small range. The ball reaches deeper than a finger and finds the point far more reliably. And you're not necessarily looking for sharp pain. More often, it's something else, a deep discomfort, a spot that feels clenched, as if the muscle balled into a fist and can't unclench, and you immediately want to knead it. When you hit a spot like that and think, oh, there it is, that's your trigger point. Let's draw an honest conclusion. If your pain is deep, dull, and aching, if it depends on your posture and on long sitting, if a cough doesn't shoot into the foot and there isn't a single red flag, then it really looks like a muscle is a big contributor. And if, on top of that, you found that clenched spot with the ball, it's almost certainly part of your problem, and then these exercises are exactly for you. But if the pain is sharp, strikes like a shock down to the foot, there's numbness or even one red flag, see a doctor first. Exercises alone won't close a situation like that, and that's the honest truth. Now the practice. First, the back of the thigh. Why start here? Because a tight thigh pulls the pelvis along with it and overloads the buttock and the lower back. Take away the foundation, and the whole floor above gets easier. For our age, we do it safely, seated. Sit on the edge of the chair. Put the other leg out with the heel on a stool or a second chair in front of you, the leg almost straight. Keep your back straight, and slowly, with your belly, lean forward toward that leg. Don't round your back, don't lunge for it with your hands, lead with your belly. You should feel a pulling stretch right here, along the back of the thigh, under the knee. On the exhale, let the body ease a little lower. With each exhale, an inch more. 30 to 60 seconds, and calmly switch legs. A common mistake on this movement is reaching for the toe with your hands and rounding your back. That way, you stretch not the thigh but the lower back, and you can overload it. So I'll repeat, back straight, the hinge comes from the pelvis, lead with your belly, and your hands simply rest freely on your leg. And if the leg on the stool pulls too hard, don't set it up high. A low footstool is enough, or just stretch it forward along the floor while you sit on the chair. And briefly, why stretch at all? In an overloaded muscle, the fibers sort of stick together and can't release on their own. A gentle stretch lets them do it. So we have a single goal, to give the muscle back its length, not to bulk it up. There's nothing to bulk up here. Remember this, because it changes the whole approach. We're not building strength, we're giving the muscle back its ability to lengthen normally. By the way, a small historical note. These painful spots in the muscles are called trigger points. They were described by Dr. Janet Travell, the physician who later treated President John F. Kennedy's severe back pain. Her work showed something very important. Pain that feels like it comes from the spine can sometimes be strongly connected to tight, irritated muscles. So this is not a random home trick. We're using the same basic idea, gently, safely, and at home. Now let's continue. Exercise 2. Glute muscles lying down. The Trigger Point Atlas says it plainly. Pain in the buttock, together with pain in the back of the leg, is called sciatica. But sciatica is just a description, not a diagnosis. And this very pain is very often wrongly blamed on a herniated disc. All the more so because after 60, a herniation, some deposits or disc narrowing, show up on almost everyone's scan. Meanwhile, the real cause, the gluteus minimus muscle, goes untouched for years. Its pain runs down the leg and looks so much like a nerve that for decades it's been taken for sciatica. So that's what we'll stretch now. Lie on your back. Keep one leg straight, stretched out along the mat. Bend the other leg at the knee and gently bring it across your body, letting the knee travel toward the opposite side, down to the floor. Now help with your hand. Place your palm on that knee and calmly, with no jerking, draw it down toward the floor, across yourself. Spread your other arm out to the side, onto the floor. That keeps the shoulder anchored down. This matters. Don't lift your head or either shoulder off the floor. The straight leg simply rests. Only the crossed over side works. Draw the knee exactly as far as it goes. There's no need to force it down to the floor. You should feel the stretch right here, over the upper and outer part of the buttock, sometimes spreading a little into the side of the hip. A pull, dull, bearable. That's what we want. If it shoots down the leg, ease off a little. That's not ours. Breathe calmly. On each exhale, let the knee sink a touch lower, just an inch. The body lets go on its own. No need to rush it. Hold for 30 to 60 seconds, then gently bring the leg back and do exactly the same on the other side. Exercise 3. Piriformis muscle, seated. Sit up straight on the chair. Place the ankle of the sore leg on the knee of the other leg, the figure 4 again, but seated now. Gently let the knee of the upper leg drop down, and calmly, with a straight back, lean forward, belly toward your legs. You should feel the pull deep in the buttock, right in the very middle. It may be the same area you felt out during the test. Lean exactly as far as the pull stays pleasantly bearable. It shouldn't shoot into the leg. If it does, straighten back up a touch. Breathe. On the exhale, ease a little lower. Hold up to a minute and switch legs. This muscle shouldn't be forced through pain. It needs to be patiently coaxed. So we work gently and regularly. It loves regularity. And don't expect a miracle from one session. The piriformis lies deep, and the stretch reaches it gradually, session by session. But when it finally lets go, very often the very leg pain that was called sciatica for years goes away with it. And a quick note for later, before I forget. This point, and all the other points from the video, are included in a simple printable guide. It shows where each point is located and where the pain can travel from there. I'll tell you where to get it right at the end. But for now, let's not get sidetracked. We still have 3 movements to go. Fourth, the quadratus lumborum. It runs along the side, from the lowest rib to the pelvis, and it's one of the most common causes of lower back pain that almost no one knows about. Lie on your back, straighten your legs. Place your palms on the side of the hip bones, on the pelvic crests, the same ones we looked for in the test, so you can feel them move. Now, without lifting your legs or shoulders off the floor, begin, as it were, to walk with your pelvis. Gently draw one side of the pelvis up, toward the ribs, while at the same moment you lengthen the opposite side down, toward the heel. Then switch. Slowly, smoothly, the pelvis seems to rock up and down. And the whole point is in the side you are lengthening at that moment. It's exactly the lengthening we're after, hence the name. You'll feel how, on the side of the lower back, from rib to pelvis, the muscle gathers and then stretches. Do 10 to 15 calm rocks. This movement also gently limbers up the lower back itself, which is why relief often comes right while you're doing it. And remember this for the future, about imbalance. This muscle is often overloaded by a difference in leg length, or by the habit of always sitting on one buttock, for example, with a wallet in the back pocket, or when we sit for a long time with one leg tucked under us. Remove that constant imbalance, and the muscle gets noticeably easier, and the exercise starts to hold longer. Exercise 5. Lower back, lying down. Now let's gently unwind the lower part of the back itself. Lie on your back and bend your knees. Cross one leg over the other, and slowly let both knees drop to one side, toward the floor. You can turn your head to the other side. Try to keep your shoulders from lifting off the floor. The pull should be right across the lower part of the back, gentle and pleasant. The range doesn't matter. What matters is the stretch. If a shoulder starts to lift off the floor, don't take the knees all the way. Stop where the shoulder still rests. If it's hard under the knees, put a pillow beside you to lower them onto. And do you know what you often hear on this movement? A light crack. Don't be frightened. It's not a vertebra going back into place, and nothing is breaking. When the muscles stop squeezing the joint, it simply gets its freedom of movement back, and a tiny bubble releases, like when we stretch in the morning. It's normal and harmless. Lie for a few calm breaths, and just as smoothly take the knees to the other side. Exercise 6. Paraspinal muscles. Lying down. Sixth, and the topmost in our set, the paraspinal muscles. These are the long extensor muscles that run the whole length of the spine, from the lower back to the very top. We've been going from the bottom up, and now we've reached them. This is the gentlest, most pleasant movement. It's usually saved for dessert. Lie on your back. Slowly draw both knees toward your chest and wrap your arms around them, around the shins or behind the knees, whichever is easier. Now gently bring your head forward, toward your knees, and the whole back rounds all the way up to the level between the shoulder blades. The back rounds gently, and the muscles all along the spine finally let go. If it feels good, you can rock back and forth a little, like a boat, a light massage for the back. Breathe calmly. Just lie like this for half a minute to a minute. There should be no through the pain here at all. This is a relaxation movement. If pulling up both legs at once is hard, do them one at a time. First one, then add the other. And if your neck tenses when you bring your head toward your knees, don't lift it at all. Leave it on the floor. The back works, not the neck. A little tip, this movement is good to exhale on. Breathe in through your nose, and on a long exhale through your mouth, bring the knees a touch closer to your chest. The breath itself helps the muscles of the back let go. 3 or 4 calm breaths like that, and the back grows warm and lets go. And that's where our path from the bottom up comes to an end. Now, briefly, how to use this so there's a result. How often? For each movement, 30 to 60 seconds per side. On the most stubborn spots, you can stretch it to 2 minutes. The whole set, 3 or 4 times a week. Better a little but regularly than once and heroically. What to expect? This isn't a one-day pill. The muscle needs time to let go. Give yourself 2 or 3 weeks of calm, regular work, and then compare how it feels. And now the important part, what not to do. Don't stretch through sharp pain. Our pain is only pulling, dull, no more than a 4 or 5 out of 10. Sharp pain is a stop. And second, with this kind of pain, it's not the time to do crunches, planks, bridges, or boats. That's static load, and it squeezes an already overloaded muscle even harder. First, restore the length and take the pain away, and we'll strengthen later once it is let go. And one more thing, maybe the most important thing for all of this to actually work. You know what's hardest in something like this? Not the exercises themselves. It's doing them regularly and not quitting after just a few days. That's exactly what I want to help you with. I've put something together for you. Let me show you what it is. It's a handout you can print out and keep, say, on the nightstand by the bed. Inside, all 6 movements step by step, short and to the point. What to do and what to feel, with no extra chatter. And on top of that, 3 things that aren't in the video itself. First, a map of the back's points. On one large page, you can see where each point lives and where it sends its pain, so you understand your own body better. Second, a simple self-massage. How to gently work such a point yourself with an ordinary tennis ball against the wall. And third, a simple 2-week tracker. You tick a box each day and the habit doesn't slip. And here, everything depends on exactly that regularity. Under each exercise, there's a link. Tap it, and a short clip of that exact movement opens right away. And it's not the whole video over again, just the piece you need, with no ads, quick and to the point. I'll leave the link below the video and in the pinned comment. It's entirely optional. The video itself is complete and free. Practice with it as much as you like. But if you'd like everything in one place and in order, go ahead and grab it. And now, a few words to wrap up. If, back at the start, during the test, you recognized your case, give it a like. That way this video reaches other people who've spent years treating the wrong problem. And subscribe so you don't lose the channel. There are more breakdowns coming for other areas of the back and neck. Work calmly and regularly, and may your back thank you. I truly hope this video has helped you. Take care of yourself and see you next time.